Hello friends, after chest x-ray, today we are going to discuss CT scan thorax. In this module, we will discuss typical signs which is there in CT scan thorax. We will discuss 32 named sign which is very important for your Viva question, NEET super specialty exam and of course NEET PG exam. So let's see one by one. So our aim of this presentation is to identify CT scan, to understand differential diagnosis, and of course clinical significance of that radiological sign. So first sign is, you can see there is black airway. So this is common ear bronchogram sign. So we all know this ear bronchogram sign is formed because of alveolar filling. Whenever there is alveolar filling, the airway is patent. Patency means ear filled, which is looks as a hyperlucent. So this is signs of parenchymal consolidation, and it helps to differentiate from collapse and mass, and doesn't always mean infection. So many things can be there with this ear bronchogram sign, like organizing pneumonia, lymphoma, sarcoidosis, lung contusion, pulmonary hemorrhage. Though they are rare, but it can be there. So now coming to second sign. So this, what is this sign? So this is very good. Fluid mucus bronchus sign. Okay. So what is this? When airway distal to an obstruction is filled with mucus. So whenever there is obstruction in the airway and distal alveoli are filled with mucus, it looks like a fluid bronchus sign. So presence of this sign indicate proximal obstruction, maybe because of mass, maybe because of any mucus plug, and we cannot say specific etiology by saying this sign. This is fluid or mucus bronchus sign in this X-ray also. So can you see this is opacity, and you can see alveolar opacity. Alveolar are patent, ear filled alveoli. So this is alveoli. Now third sign is, so you can see there is homogeneous opacity, heterogeneous opacity, and inside you can see one vessel. So this is CT angiogram sign. In this also, this CT scan, you can see this is solid mass-like structure, and you can see white lines. So this is CT angiogram sign. So this is prominent branching vessel transversing through a homogeneous low attenuation area of lung consolidation. And initially it was described in invasive mucinous adenocarcinoma, and it is 92% specific for that. But nowadays further study shows that other disease may also have this sign, like pulmonary lymphoma or necrotizing pneumonia. Now coming to fourth sign. So what is this sign? This is common sign, and this is the clue. So this is very good. Halo sign. Halo sign is, there is opacity, radiolucent opacity in center and surrounded by ground glass appearance. So this is nodule or mass surrounded by ground glass attenuation. This is halo sign. So if you see halo sign, so you can see there is granuloma formation and surrounding that hemorrhage. So this is coagulation. This is coagulation necrosis. It causes hemorrhage. Okay. So this is early sign of acute aspergillosis if it occurs less than 10 days, and we can label as invasive pulmonary aspergillosis in neutropenic patient and can start therapy because of this sign. So this is quite specific, 90% specific. Other disease, mucormycosis, vasculitis, adenocarcinoma, septic emboli, and sarcoidosis. So these signs can be there in this disease also. Now fifth sign. So this is what sign? So you can see homogeneous opacity, radio opaque opacity, and you can see ear in this. This is ear crescent sign. So ear crescent sign, what is this? This is development of ear crescent within the consolidation of mass. So whenever there is disease is there, first there is formation of consolidation, whole opacity or whole radio opaque opacity. Whenever there is necrosis, this part is expelled out because of necrosis. So this causes ear crescent sign. So necrotic slough at the center separate out, usually seen in second week, and it indicates recovering disease because of necrosis, this part is coming out. Hence, this is favorable prognosis. This is ear crescent sign. Now, sixth sign. This is similar to ear crescent sign, but this sign is called monad sign or fungal ball. So, what is the difference between two? So, ear crescent sign is just crescent or circumferential rim of radiolucent air space within parenchymal consolidation. And what about monad sign? So, this is a cavity, and inside cavity there is fungus ball. So this is monod sign. Differential diagnosis: if acquiescent sign in invasive aspergillosis, bronchogenic carcinoma. Monod sign is specific for aspergilloma. Cavity, inside the cavity, fungal mycelia. And if you do CT scan in prone position, the shape of this opacity will change in monod sign. But acquiescent sign, it will not be changed. So there is no positional change in acquiescent sign, but monod sign it will change. Acquiescent sign, as I told you, usually seen in immunocompromised patient, and this is seen in immunocompetent patient because this is something called the fungus ball pre-existing cavity, and fungus will go and sit there. So this is seen in immunocompetent patient. Now, what is this sign? This arrow. So you can see there is radiolucent opacity surrounded by radio opacity. Okay, in this CT scan you can see better. So inside you can see ground glass surrounded by a rim of consolidation. So this is reverse halo sign or atoll sign. So peripheral patch of consolidation with central area of ground glass attenuation. This is reverse halo sign. Initially considered pathognomic for organizing pneumonia, but further studies shows that it is not only seen in organic pneumonia but can also seen in other diseases also. Number of diseases are there like infectious disease, histoplasmosis, cryptococcus, tuberculosis, psittacosis, non-infectious disease like COPE, vasculitis, sarcoidosis, pulmonary thromboembolism, lipoid pneumonia, pulmonary edema, HP. So these are seen in many diseases, but most common disease is if patient is immunocompromised, it is mucormycosis. If it is immunocompetent patient, then organizing pneumonia. So this is atoll sign. Number 7, can you see different opacities in the CT scan? So this is feeding vessel sign. So you can see opacity and you can see that vessels supplying to it. We can see this vessel. This is feeding vessel sign. So this is nodular cavity with distinct vessels leading to into it. This is feeding vessel sign, and it's suggestive of hematogenous spread or origin of the lesion. Causes septic emboli, metastasis, vasculitis, angiovenous infection, pulmonary infarction, pulmonary arteriovenous malformation. So whenever there is spread of disease by blood vessel, then this sign can be there. This is feeding vessel sign. Now number 8. So what is this sign? Very good. So this is ear bronchus sign. So there is opacity and supplying to this opacity is patent bronchi. So presence of airway directly leading into nodule. Okay. So presence of this sign, then there is high chance of getting diagnosis by bronchoscopy because airway is connected to that opacity. If you do bronchoscopy, you can reach up to here and you can take bulb from this opacity and there is high level of chance to get diagnosis. This is ear bronchus sign. Now number 9. So what is this opacities, ring shadows? Very good. So this is cheerio sign or open bronchus sign. So what are these? This is looks like a serial Cheerio. So this is pulmonary nodule with lucency resembling the serial Cheerio. So this is Cheerio sign. So it is typically described in adenocarcinoma and PLCH. And why it happened? It is because of proliferation of airborne cell surrounding the airway. So because of proliferation, these signs occur. Other causes, it may be seen in tuberculosis, it may be seen in fungal infection, Wegener's disease, rheumatoid nodule, and metastasis. But common in adenocarcinoma and PLCA. This is Cheerio sign or open bronchus sign. Number 10, this is, what is this? This is crazy paving appearance. This is crazy paving. Can you see? this type of the floor you might have seen. So this is clay paving appearance. So this is nothing but thickened interlobular septa with ground glass opacity. You can see this is ground glass and this is septal thickening. Can you appreciate? This is septal thickening. So ground glass with interlobular septal thickening is crazy paving pattern. So it was classically described in PEP, pulmonary alveolar proteinosis, but nowadays is also there in ARDS, organizing pneumonia, infections like PCP, viral mycoplasma, pulmonary edema, hemorrhage, hypersensitivity pneumonitis. So we should keep in mind this differential diagnosis because this is frequently asked question in your exam. The crazy paving appearance may be seen in all these conditions, but classically seen in PEP. Number 11, can you see this opacity? And surrounding this opacity, you can see this type of small. So the so this is corona radiator sign or speculated margin. Okay. So this is seen in malignancy, more than 90% specificity. Can you see this is like a opacity surrounding this like a hair-like structure, like a sun rays. There is sun and rays are there. This is corona radiator sign, and also seen in tuberculosis, lipoid pneumonia, and silicotic nodule. So these are the differential diagnosis about corona radiata sign. Now, 12th sign is, can you see this arrow? So arrow, what is this sign? This is beaded septum sign. Okay. So there is nodules in the septum. Whenever nodules are there, and this is perilymphatic nodules. Okay. So whenever perilymphatic nodule present on septum, this is beaded septum sign specific for sarcoidosis. Now, number 11. So, what is this sign? So, you have clue. This is galaxy sign. Very good. So, what is galaxy sign? So, galaxy sign, this is conglomeration of granulomas. Multiple granulomas, they are stick together. Produces mass-like structure. And surrounding, you can see discrete granulomas. Small nodules. These are nodular granuloma. So large mass because of conglomeration of granuloma surrounding nodules. This is galaxy sign, specific for sarcoidosis, typical for sarcoidosis. Galaxy sign, most frequently asked question in your exam. Number 12. So what you can see here, you can see there's patches of nodule, multiple patches. So this is sign is called cluster sign. Again, this is also common in sarcoidosis. So there is collection of multiple small punctiform nodules without a large nodule. In previous slide, there was large nodule. Here, multiple clusters. So this is seen in sarcoidosis. Non-specific may be seen in tuberculosis also. This is cluster sign. Now, number 13. So in this, you can see this arrow. So this is tram track sign or tram track appearance. So have you seen tram? Tram are coming like that railway line. Okay. So this is seen in bronchiectasis. Why this is seen in bronchiectasis? Bronchiectasis, there is dilatation of airway. So whenever there is dilatation of airway and because of thickening of wall, it looks like a tram track. So non-tapering of airway for 2 centimeter beyond a branching point. The branching point is here. If 2 centimeter it is not getting taper, this is tram track appearance specific for bronchiectasis. Now this sign is again this sign is seen in bronchiectasis. This is signet ring sign, like a ring. So you can see. So this is dilated bronchi because of bronchiectasis, and this is blood vessels. Normally, pulmonary artery and bronchi are equal size, but in bronchiectasis, the dilatation of bronchi, and this is same. This is signet ring sign seen in bronchiectasis. Now 15. Can you this opacity? This is mediastinal window. This is parenchymal window. So this is Hem sign, high attenuation mucus sign, Hem sign. So what is Hem sign? So Hem sign is just mucus plug with attenuation higher than that paraseptal soft tissue. So this is paraseptal soft tissue. If density is more than that, can you see this white density? If it is more than 70 Hausenfeld unit, then this is Hem sign. In pericardial window, you can see complete obstruction. And in opposite lung, you can see many nodules with teen bud appearance. And you can see bronchiectasis also. So this is classical sign of ABPA. So Hem sign is classical sign of ABPA. And whenever you find Hem sign, it has clinical significance. So it is pathognomic, it is 100% specific. If you find Hem sign, you can say 100% this is ABPA. But sensitive is only 20 to 40%. Okay, so this is not sensitive but very specific. If you find Hem sign, then patient is having immunologically more severe disease, and it is also marker of ABPA relapse. So whenever you find ABPA, that patient has high chance of recurrence. So in this study, you can see there is ABPA serology, ABPA with central bronchiectasis and with harm. So those patients who are having Hem sign, they are having more IgE level, more specific IgE level, more eosinophilic level, and number of lapses are more than other categories, and all are significant statistically. So Hem sign, if patient is having Hem sign, that patient is having more exacerbation problem, along with high immunogenicity. And what is this sign? So this is finger in glove sign. So this is just dilatation of bronchi filled with mucus, again seen in ABPA. So this is dilated bronchi filled with mucus. Now 17. So what is this sign? Can you see this arrow? This sign. So this is looks like a branch of tree. So this is tree in bud appearance. Okay. So what is this? This is centinodal nodules in the pattern of buds on the branches of tree. So there's branches of tree. In that tree, you can find mucus. Because of mucus, it looks like a tree in bud appearance. It's a tree in bud appearance. So this indicate bronchioles filled with any substance, let it be mucus, blood, or pus, and it indicate endobronchial spread of disease, not always seen in tuberculosis. And whenever you find teen bud appearance, then there is high chance of getting diagnosis by sputum or ball. This is teen bud appearance. So it can be focal or diffuse. If it is focal, means some segment or lobar is involved, then the differential diagnosis would be infectious bronchiolitis like viral, bacterial, microbial, parasitic, or fungal. If it is diffuse, involving both lung, then problem is some systemic disease like congenital disease, cystic fibrosis, or dyskinetic cilia syndrome. This is maybe because of a diffuse aspiration bronchiolitis or diffuse pen bronchiolitis. So we must differentiate. If focal is there, then different differential diagnosis. If it is diffuse, then there are other differential diagnosis. This is teen bud appearance. Now, what is this sign? So this is very good. Mosaic attenuation pattern or patchy lung opacities. So as name suggests, this is patches of different attenuating lung opacities. Can you see this is white, this is black. Okay, you can see this is white, this is black. The two different density is called mosaic attenuation pattern. So now two things are there. Which one is abnormal, which one is normal? So if you see this CT scan, so black could be abnormal. If black is abnormal, why this abnormality happened? Because of reduced vascularity, or called oligemia, less blood supply, or air trapping. So if it black is abnormal, then two conditions are there: reduced vascularity or air trapping. And white is normal. This is called mosaic oligemia or perfusion because of less perfusion. Let it be pulmonary embolism. Okay, so this is mosaic oligemia or perfusion. If black is normal, white is abnormal, this CT scan. So black is normal, okay, and white is abnormal. then white is GGO, ground glass opacity, while black is normal. So two things are there. Okay, so how to differentiate between these two conditions? So we have to see blood vessels in, and we have to compare both densities. If blood vessels are decreased in black area, then black area is due to reduced vascularity or air trapping. If blood vessels are same, see blood vessels are same in black area and white area, then the problem is with white color. Then abnormality is this one, GGO. So blood vessel is less, it means less vascularity or oligemia. So that is called mosaic perfusion. So mosaic perfusion, it may be due to airway, small airway obstruction or vascular. So what we have to do? We have to get CT scan in expiratory phase. So expiratory phase, what will happen? If there is airway disease, then expiratory, what will happen? The black area will get increase. So this is inspiratory film, this is expiratory film. So in small airway obstruction, the black area will get increase. Then this is problem is because of airway obstruction. If there is same inspiratory and expiratory film, the black area and white area are same, then this is because of reduced blood supply, maybe because of pulmonary embolism. So this is how we are supposed to differentiate between airway and vascular. So 19th sign is continuation of previous sign. So if you find mosaic perfusion, if it is due to reduced vascular supply, maybe because of pulmonary embolism, then this is called Western mark sign or focal oligemia. So this black area is because of reduced blood supply because of pulmonary embolism. This is Western mark sign. Now, what is this sign? So in this sign, it looks like a this meat. So this is head cheese sign or triple density sign. So head cheese sign is previous name, but now current name is triple density sign. So what is triple density sign? So triple density sign, just as name suggests, we will see three opacity. We will see ground glass opacity, ear trapping here, and normal lung. So these are three opacities. So we can find normal lung, air trapping because of small area obstruction, and ground glass. This is classically seen in hypersensitive pneumonitis. Okay, hypersensitive pneumonitis, but other differential diagnosis, sarcoidosis, RBILD, and mycoplasma pneumonia. So how to differentiate between hypersensitive pneumonitis and other disease? So we have to get expiratory phlegm. As we know, in hypersensitive pneumonitis, there is involvement of small airway also, bronchi level. So in expiratory phlegm, that area, black area will get increased. If it is get increased, this is because of hypersensitive pneumonitis. If it is same as inspiratory phlegm, then we have to think of other differential diagnosis. This is head cheese sign or triple density sign. Now 21 sign. So you can see this is pulmonary artery, and you can see this is some opacity, black opacity. So this is called saddle sign. This is classically seen in pulmonary embolism. So there's partial obstruction because of pulmonary embolism. This is saddle sign. Now 22nd, what is this sign? So this is complete cut off this pulmonary artery, right pulmonary artery. This is Knuckle sign and Chang sign. Okay, so because of this obstruction, the dilatation of pulmonary artery, dilatation of proximal pulmonary artery is called Knuckle sign, and complete cutoff sign is called Chang sign. This is Knuckle sign and Chang sign, classically seen in complete obstruction due to pulmonary embolism. Now, what is this sign? So this is again, this is pulmonary artery and this is obstruction. And you can see this sign. So this is called railway track sign. Don't confuse with tram sign. Tram track sign was seen in bronchiectasis. This is railway track sign. Okay. So railway track sign is seen in pulmonary embolism. while that sign was seen in bronchiectasis. So if there's partial filling of pulmonary embolism, this sign will get occur. So now 24th sign. So what is this sign? You can see this arrow. So this is pyramid sign or donut sign. Have you seen donut? So you can see surrounding vascularity inside pulmonary embolism. So this is classically seen in pulmonary embolism. There is partial filling defect seen in pulmonary embolism. Pyramid sign or donut sign. Important for your exam. Now 25th sign. So can you see this sign? So this is non-contrast CT. This is angiogram. So in non-contrast CT, if you find this sign, this is hyper attenuating sign. Okay. So slightly whitish is there. If you find whitish color in pulmonary vessels in non-contrast film, then you should think of pulmonary embolism. Same patient, if you do pulmonary angiogram, then you can find pulmonary embolism. This is hyperattenuating sign seen in pulmonary embolism. Now, in same CT scan, you can see this is white color, non-contrast CT, white color. This is hyperattenuating sign. If you do pulmonary angiogram, you will find same pulmonary embolism. Okay, in this you can see this is pulmonary trunk, right pulmonary artery. You can see white color, hyper attenuation. If you do angiogram, you can see pulmonary embolism, same site. Here, white is, can you see white is? This is pulmonary embolism. So this is quite specific. If you see specificity, almost 100% specificity. So if you find hyper attenuation sign in non-contrast CT, then you are almost 100% sure that you are dealing with pulmonary embolism. So why this hyper attenuation is seen? Because of retraction of clot lead to decreased water content of the clot. And because of that, there's increased concentration of RBC in the clot, which lead to increased attenuation and hence the hyperdense sign. So this is classically seen in pulmonary embolism. Now, what is this sign? This is common sign. This is very good, split pleural sign. Okay. So whenever there is collection of fluid and surrounding that pleural thickening. So this is pleural thickening. Can you see white color? Pleural thickening inside that pleural effusion. This is split pleural sign. Now 27. What is this sign? So this sign is pometel sign or crowfoot sign or crab nipper sign. All three are same, and this is frequently asked question in your exam, MCQ exam. So this is cometel sign. Sorry. So why this happen? This happen because of round atelectasis. Round atelectasis is seen in mainly asbestosis. So in asbestosis, there is round atelectasis. There is focal, collapsed, and often folded region of lung always occur in atrial pleural thickening. So pleural thickening is there, and this lung folding is there. And because of lung folding, it pull blood vessels towards it. So this is blood vessels. It is getting pulled by this round atelectasis. So this looks like a comet-tail sign. What are the differential diagnosis? Pneumoconiosis, asbestosis, and exudative fusion like TB and hemothorax, but classically seen in asbestos-related pathology. Now 28th sign. So this is, what is this sign? This is dark bronchus sign. So in this opaque lung, you are able to see this dark bronchus. So this is seen in patient with pneumocystic gyrovesi. So the presence of air-filled bronchi that appear too black within GGO is called dark bronchus sign. So 29 sign, can you see honeycombing on anterior part? So this is anterior upper lobe sign. So there is honeycombing in upper lobe bilateral anterior sign. This is classically seen in rheumatoid arthritis related interstitial lung disease. What is this sign? This is extensive honeycombing. Can you see extensive honeycombing? So this is exuberant honeycomb sign. Again seen in rheumatoid arthritis related ILD. And what is exuberant honeycombing? When honeycombing involves more than 70% of fibrotic lung. This is exuberant honeycombing sign. What is this sign? Again, this is honeycombing and this is straight S sign. So if you see this image, you can see minor fissure and it looks like a straight line. Upper part is speared, lower part is extended honeycombing. This is straight S sign again seen in RAILD. Okay, this is classically seen in coronal CT scan. Now last 32 sign, 32 sign. This is this is you can see upper lobe, this bilateral upper lobe, and this is lower lobe, posterior side. This is four corner sign. Again seen in rheumatoid arthritis related ILD. So if you see overall four sign in CTD ILD, the specificity is very high. If you find this sign, you are almost sure that you are dealing with RAILD, but sensitivity is low. So these are the 32 signs I have discussed. So kindly remember it. These are very important. And the conclusion part of this presentation is that always you have to interpret it with clinical context because these signs may be seen in multiple disease. So this is that's all. So see you with another video. If you like this video, please like it, share it with your friends. And if you're not subscribed to this channel, please subscribe it. See you with another video. Thank you very much.